Hey everybody, welcome back to the Her Sacred Place channel. I know by the title, you already know what we'll be talking about today. Yes, it's your period. Specifically, when it comes to the color of your period, whether it may indicate you have an underlying health condition, where you may have a STD or an infection, or any other thing that's going on. So if you haven't already, make sure to subscribe to this channel and hit the notification bell so you'll be notified each and every time I upload a new video. But we'll go ahead and dive right on into talking about our periods. So first, before we get started, I want to let everybody know that as a woman, young girl, if you have started having your period or your menses or you're now a missy girl, it is very important to track your period, to know whether how many days it is between one period to next, to know how long it's been on. You will be able to tell your ovulation schedule more when you're not ovulating. And so I always tell clients who come in who have period problems, because a nice healthy period should come on every 28 to 30 days. Anything beyond that is considered a little short, and anything below that is considered a little short, and anything beyond that is considered a little long menstrual cycle. So if your period comes on every 28 to 30 days, I know I have people who come in and they don't necessarily track the number of days it comes on. Instead, they look at the fact that, oh, my period comes on the 15th of every month, or comes on around the 15th of every month. And every year in between the months of February and March, I get a lot of calls like, oh, LaQuinta, my period is late, or oh, LaQuinta, my period is early. Well, depending on the year, February will have 28 days or 29 days. And so as the months going on, if you're going from 28 days to 30 days to 31 days to 30 days, the 28 days, whatever the case may be, your period will fluctuate. Actually, if you're on a very, very healthy moon cycle, you may be on your period with the full moon, or you may be on your period with the new moon. And that's actually a better way of tracking your period than just to say it comes on around the 11th of every month or around the 12th of every month. That's not a good indication of how you should be tracking your period. Now, there are a lot of period apps out there. I personally use OvuView, but there are thousands of them at this point where you can track your ovulation, track your period, track any stages of your menstrual cycle to kind of see what's going on. And I urge all women to do that from time to time. Take a look at what's going on with your period. Like I say, how long it's been on, how many days did it last, XYZ. So that we will know what's going on with our bodies and things like that. So again, our period can tell us a lot. We have been blessed. Even though some people call it a curse, don't look at it as that. We have been blessed to have a period every month, so that before we even get a medical diagnosis, or before we even realize something is going on, our menstrual health, our period health can tell us if something is going on in our body or not already. With that being said, we'll talk about a few of the different colors of the blood and what that may mean. So the first color we're going to talk about is gray. As you know, in previous videos, and that video will be linked right up here, gray discharge, gray blood, gray slimy stuff, or anything like that coming out of your vagina or your sacred place is usually a sign of an infection, and a bacterial infection, more commonly bacterial vaginosis. Especially if you have any type of gray discharge or gray blood associated with itching or pain or fever or a foul odor or anything. Whenever you see any type of gray discharge or gray blood coming out of your body, it's very, very important to seek medical attention as soon as possible, because that's a sign of a bacterial infection. So you should check with your healthcare provider. Also, if the blood is gray and it's really, really heavy, like it's flow heavy and it's gray, in addition to possibly an infection, it could be a sign of a miscarriage. Again, that's important for you to check with your healthcare provider or anybody like that, to see if you possibly may be miscarrying, especially if you know you are pregnant, and how all of a sudden a thick, heavy discharge is coming out, or it seems like a thick gray blood is coming. That could be an early sign of a miscarriage. So either way, whenever you see any type of gray discharge or gray blood or anything gray happening, it's important to check with your healthcare provider and see what's going on, because that's a symptom that something is definitely wrong, whether it's a sign of a miscarriage or it's a sign of a bacterial infection. The next color we're going to talk about blood that is brown, black, or purple. I know some of you are like, oh my God, people have brown blood, purple blood come out during their menses. Yes, it does happen. I personally treat or help a lot of clients who came in at Her Sacred Place and initially dealt with dark colored blood to the point where it was black and clotty, and now we've gotten them to a bright red, healthy state. But most commonly, women experience brown blood at the beginning or the end of their period. So it may start off really dark brown, purplish, blackish. Then as their period goes on, it will lighten up into a red color, and sometimes by the time it's going back off, it may get brown again. However, on the contrary, some women only see brown, black, or dark blood at the beginning, and then some people only see it at the end. Depending on what's going on with your body, that is a form of stagnation. And if you deal with this, let me know in the comment section if you see any brown blood toward the end or brown blood at the beginning, and we'll talk more about that, because typically women who see brown blood at the beginning, brown blood, black, purple, dark color blood is what I can use as an all-encompassing term. Typically women who see dark colored blood at the beginning or end of their period usually have long periods. And when I say long periods, a nice healthy period is typically lasts 4 to 5 days. These women's periods may stay on for 7 to 10 days. And it's very common, but we do have a special plan at Her Sacred Place that we can help so that we can get your period down to a healthy state. But basically, whenever you're seeing a very dark colored blood while your period is on, it means that the older pieces of your uterus are being flushed out, and even though in traditional Western medicine it's considered normal, is not healthy. And at Her Sacred Place, we view that as stagnation. Is just not a proper blood flow where it's fresh blood. Either the blood is getting stuck in your uterus and staying there too long, which causes it to get a darker color, because the older blood will get a darker color, or it's flowing very, very slowly, and more oxygen is getting into it, and by the time it expels through the vagina, it's heavily oxygenated and it's not red anymore. It's more of a brown rusty color. But overall, whenever you notice that you are dealing with dark blood during your period, whether it's at the beginning, end, or I didn't mention this before, but some people only see dark colored blood. They don't see any type of red blood. It's just dark the whole time, and it's usually accompanied with a foul odor, just for the mere fact that the blood is old, and so it's gotten old, it's gotten dark, and it's begin to develop an odor. But once you begin steaming with us, you will notice that you don't have that problem anymore. The blood is nice, fresh, red, and odor free. Another thing that can cause brown blood is egg implantation during early pregnancy. That typically light bleeding will occur. It wouldn't be like a heavy period blood flow, but it may be light spotting, and it could be brown. So if you're trying to get pregnant, or you think there is a sign of pregnancy, it's important to note that like spotting of brown blood could be contributed to implantation bleeding. Overall, when it comes to dark colored blood in your period, it's important to know that, again, while traditional Western medicine may say that it's normal, it's still not healthy. That's poor blood circulation. And Just think about it. Anything that deals with poor blood circulation, if your period isn't circulating properly and it has poor blood circulation, what do you think is going on in the rest of your body if that's happening? You're probably, I'm not saying that you are, because I am not a medical professional, but in my expertise of doing this for the past few years, you probably are more likely to develop blood clots, because it's not only happening in your vagina. As I say, our periods tell us a lot about our health. So number one, if your blood is flowing slowly and not circulating properly, make sure, drink more water, get your blood flowing, flush your system, do things like that. You may not have enough fluids and maybe suffer from dehydration, and that's why your blood is flowing more slowly. But either way, brown, dark, purple, black, any type of dark colored blood isn't really healthy, even though it may be normal for you. And if you want to talk more on this topic, definitely in the description box, you can reach out to me and book a consultation, or better yet, leave a comment below and let me know if you suffer from this and you want to have a consultation, and we can talk more about that, okay? All right, moving on to next. We've already talked about brown, black, and purple, which is very, very dark blood. Now we're going to talk about just like a dark red to a regular red color. So healthy period blood can range from a bright red to a dark red, depending on how your diet is, how much you exercise, or things like that. If you see a bright red blood outside of your period, that may be a sign of light spotting from a hormonal imbalance as a result of ovulation or implantation bleeding. Like I was saying earlier, when you may see a little bit of brown blood during implantation bleeding, there's also a chance that you may also see just fresh red blood during implantation bleeding. Some women may be actively trying to get pregnant, and when they see, they're like, oh my God, I'm spotting a little. It's not really a period blood flow, it's just spotted. That could be a sign of implantation bleeding. Also, if some women report that they get ovulatory cramping. That means around the time that they're ovulating, they get cramping, and they also have spotting during ovulation. There's not a lot of research out here on that topic, but if you're one of those women where you spot during ovulation, let me know below. I typically find that most of my women who deal with I typically find that most of the women who deal with endometriosis, fibroids, PCOS, whether it's just regular PCOS or just a cyst, tumors, anything like that, I found that they typically tend to have more ovulatory bleeding. Usually women with a nice healthy cycle typically don't have that ovulatory bleeding. So if you notice that you have ovulatory bleeding, that light red spotting a couple days or just a couple hours during your ovulation, leave a comment for me below, and also let me know if you suffer from fibroids, endometriosis, or anything like that, or if you completely suffer from nothing at all but you still have that red spotting during your ovulation phase. I'm interested to learn more about that. Also, red bleeding outside of the period, because we know healthy period blood can range from dark red to just a regular bright red, but overall it's just a red color. But when you're bleeding or you're having red spotting or bleeding outside of the period, like sometimes women report to me, LaQuinta, my period just went off last week, but again, I'm bleeding again, or I'm spotting again. And it's a bright red color. It's not brown, it's not pink, it's not anything else, but it's a bright red color. That typically is a sign of ovarian cyst. And typically cysts can go unnoticed. They are very, very painful when they rupture, but a lot of women may or may not know they suffer from ovarian cysts, because sometimes they can be disappearing cysts, and they come and they go and they come and they go. So with that being said, a lot of the times women don't know if they have ovarian cysts, but anytime there's bleeding outside of the period, or you have other symptoms such as pain during sex or a lot of abdomen bloating, I would suggest that you seek out medical attention from your doctor and have an ultrasound just to see if you may have ovarian cysts or you may have PCOS or anything like that, because bleeding in between periods is typically a sign of something going on, whether that is ovarian cysts, whether that's endometriosis, whether that's fibroids or anything. It's a sign of something going on. So whenever you have bleeding outside of your period, especially if it's bright red blood, that means it's fresh. It's not old blood that's just trying to come out. That's fresh red blood. I definitely suggest that you seek out a medical or healthcare provider for that. And if you want to chat with me to learn more about that, definitely, again, leave a comment below and I'll respond, or reach out to me and we can set up a consultation. Okay, moving forward, just for a brief a brief minute, we're going to talk about neon red blood and orange blood. Now, when I say neon red blood, I'm referring to blood that is a bright red, like it's glowing red. Some women have this happen to them, and basically that happens, or that occurs for a lot of women who are in menopausal stage. They're red, instead of it being like the consistency or the color of like meat blood that you would see at your typical supermarket. Some people respond to it as it's just red like meat blood. It's like a glowing red color, and that means there's a lot of heat built up in your body. Some of these women tend to even radiate heat. You can stand next to them and feel the heat coming off of their body. That's how hot their body temperatures are. If you want to learn more about that, definitely leave a comment below, but I don't want to go into a lot of detail about that because most of these women already know. They suffer from a lot of hot flashes. They suffer from a lot of night sweats. They're always hot. They have to keep a fan with them, but they have this really, really bright red flow, and that's an indication that they have a lot of excess heat built up in their bodies. Going on to orange blood, which means it's not really red, it's more of an orange color. That basically indicates that you may have or may be borderline, or you may already know that you have a blood deficiency. Basically, there are not enough nutrients in the blood to give it that bright red color that typical blood is. And so if it's more of a like dull red, or it's more of a like an orangish color, and if you see that in your period right now and you don't know what's going on, or you thought that was healthy, because maybe you don't really talk much about your period with anyone, orange blood or a dull red blood is a early sign of anemia. So if you're dealing with that, it's great to get checked out by a medical professional, because it is an early sign of anemia and you may be experiencing a blood deficiency. On the other side of that, if you have an orangish rustic color blood and it has a smell to it, you probably have an STD. With that being said, so anytime your period blood has a very, very foul odor to it, I would recommend seeking out medical attention, because it's probably infection. You probably have a vaginal infection also with that. So I say that to say the orange blood could mean that you have a nutrient deficiency, or you may be anemic and you already know this, and so you're probably taking those steps. But it's an early sign of anemia. Or on the flip side, if it's orange and it has a off-putting malodor, it could be a sign of an STD. Okay, so that's talking about orange and bright red infections. In the next part, we're going to talk about, or I should say the last actually, because we've talked about dark colored blood, which is old blood. We've talked about red healthy blood and orange blood. Now we're going to finish up with pink blood. So pink typically is a sign of spotting. People really don't think of it as a full-blown period when it's pink. Usually people experience a lot of pink bleeding when their period is either coming on or is going off. It's an indication of a light flow, like, okay, my period isn't heavy right now, it's light. So it's more of a pink blood, and that's really healthy and really normal for it when the first comes on it to be a lighter red color than it would be than when you're in a heavy flow. It could still be fresh menstrual blood, it's just very light flow, so it comes off as a more pinkish color than red. However, if you see that you only have pink blood even a day into your period, so like I was explaining just now, you may see that your period comes on light pinkish, goes red, and then goes off light back to pinkish again. So if you notice that there is no red, it's just light the whole time, and it's pink the whole time, that's a possible sign that your estrogen levels are very, very low, and you should seek out a medical professional to have some tests done, or possibly take some natural herbs that can help bring your estrogen levels up. Or if you're interested in doing the medicinal route, you can ask to be placed on, or suggest to be placed on, artificial estrogen or man-made estrogen to help get your estrogen levels up. But essentially, just only seeing pink blood throughout the entire menses or your entire period is a sign of a low estrogen level. Also, women who work out a lot, who weight lift a lot, who do a lot of cardio, not necessarily more flexibility things like yoga or Pilates, but women who have a more strenuous workout routine, notice that they have only pink blood during their periods, and it's not really a heavy flow. And so that could be, I wouldn't say normal, but that is common and healthy for women who work out a lot to not really bleed a lot. They basically just have a pink flow for about 1 to 2 days and their period goes off. So on the flip side, if you fall into that category, I wouldn't be worried too much. But if you don't fall into that category, then I always recommend, anytime you feel like something is going on, to definitely see your doctor. Outside of your regular period, we already talked about this when we talked about ovulatory bleeding or ovulatory spotting. But again, pink spotting during your ovulation cycle is common among some women who have the fibroids, endometriosis, cyst, or anything like that. It's very common. It's very common. So outside of your regular period, we already talked about ovulatory bleeding earlier in this episode, so I won't go into a lot more detail about it. But again, if you see pink spotting during your ovulation phase, some women do have that, and that's normal for those women to have that. Also, if you get pink discharge when you're not on your period, all the time, is not really a heavy flow. It's just that you're always spotting pink and you don't have any other thing going on, such as fibroids, endometriosis. Basically, you don't have any other vaginal or womb issues going on besides the pink discharge. Then you should, it's an early sign of cervical cancer. So you should definitely seek out a doctor or seek out your OB/GYN to say, hey, I'm spotting all the time. I don't know what's going on, but I tend to be spotting all the time. That is a sign of cervical cancer. So it's very important to get checked out by your healthcare provider. So those are the colors that I wanted to talk to you about when it comes to your period. You can even have that dark blood, which indicates stagnation. You can have pink blood, you can have red blood, orange blood, or whatever is common for you. Let me know in the comment section how is your period? What is the color of your period? Is it just a nice red flow? Do you have brown sometimes? Do it fluctuates and sometimes you have brown, sometimes you don't? Just let me know what you have going on and we'll talk about it below. I want to end up this video by saying when it's best to visit a doctor as it relates to your period blood color or your period in general. Number one is if you have any bleeding between periods constantly. If you're always constantly bleeding in between periods and you have no known womb or uterine issues, it's important to seek out a healthcare provider so they can possibly run some tests or do an ultrasound to see if there is anything going on with there and indicate why you may be having that bleeding in between your period. Another thing is if you have significantly irregular cycles. With that, your cycles can go from 28 days, and then the next period comes on in 24 days. Then your next period comes on 40 days later. So if your period, the time from one period to another, also known as your menstrual cycle, seems to fluctuate a lot, it just bounces around, I will seek out a healthcare provider also, just to know what's going on, because that is a sign that something may be going on or some imbalance is happening for your period to not be on a consistent 28 to 30 days. If you haven't had a period in over 3 months also and you aren't pregnant, I also highly recommend to see a health care provider. Another caveat to that is if you're not on any type of birth control that prevents you from having a period, and you're just not having a period for months at a time, it's very important to get checked and see what is going on with that. Also, very, very important, if you know you are pregnant and you experience any type of vaginal bleeding at all, immediately call 911 and seek out medical attention, because you could be threatening or something is going on and you may be at a high risk of miscarrying. Also, if you have gone through menopause, if you have already gone through menopause, and most in traditional Western medicine, our doctors look at it as if you haven't had a period for 12 consecutive months, they consider you through the menopausal stage. And if you have already gone through menopause, or you haven't had a period in over a year, and now you're starting to experience some vaginal bleeding, whether it's a heavy bleeding or just light spotting, that is a sign of different type of cervical cancers or uterine cancers. So if you know you are postmenopausal and you are beginning to experience vaginal bleeding, it's very important to seek out medical attention, because that could be an early sign of some type of cancer forming. Also, if you have some unusual pain during your period. Now, this isn't your typical period pains or period cramping that a lot of women experience. But once you begin working on my plan with me, my women typically don't have period problems anymore, and we don't deal with period pains. But if you have unusual pain, let's just say on the left side, when your period comes on the left side, you're just, oh my God, it's just hurting so bad in that one area, it's unbearable, or your back is just killing you, which we'll talk about in a future video, but that's a sign of dehydration. Anything there's unusual pain, seek out medical help. And as I stated multiple times in this video, you can book a consultation with me. My number is my contact information is in the description section for you to do that. And with that being said, we can talk about what's going on with you, what I believe may be going on, what your medical professional is saying also, and we can develop a plan for you to help deal with anything that you have going on. But period blood and the colors and the textures of it may vary throughout your cycle. Like we was just explaining, some women start off brown, some women end up brown, some women start off pink, some women end up pink, some women have red blood this month, some women have brown blood this month, whatever the case may be. But it's very important to pay attention to your body and what's going on, because little changes in the period blood, they don't necessarily suggest that you have a health problem, but you could potentially have a health problem. So it's important to know what is normal and healthy for your body. And with that being said, definitely leave me a comment below if you have any questions about anything that we talk about as it relates to your period and your period blood color. And I'll be on the lookout. If you want to book a consultation with me for us to talk more, just contact me by email. The contact information is in the description section. And I will see you guys next Monday, where we talk more about periods. I believe on next Monday we're going to talk about your period flow and what the different flows of your period can mean. So be on the lookout for that, okay? And like always, this is her sacred place, and remember to always embrace your sacred place. See you later. Bye.